Welcome.
Hello.
Hello. Welcome back, Cowie.
Thank you.
And today we are also joined by our colleague Josh.
Yeah.
First time on the podcast.
The resident pest.
We're very excited to be bringing today's episode. We're going to be chatting about School Can't today, which we have all had some level of involvement in some form of a presentation on this topic in the last few months.
Yeah, for either parents or carers, which yourself and Josh headed up.
Yes.
Or for clinicians, which me and you, Katie, headed up. So,
unfortunately, I put in a decent amount of work on that first one, and then I ended up with COVID. So you got to present on that.
Yes, I was able to cross the finish line with none of the run.
Take all the glory.
Yes, but I wanted to have you both on this podcast because I know that you've spent some time going through sort of the up-to-date evidence on this area or knowing a little bit more about what the pathway or journey of School Can't can kind of look like for our kids and teens that we're working with. So I suppose I'd love for you to start with why are we talking about School Can't? Because I know that a lot of people may not actually even know what School Can't is, but may have heard of school refusal before.
Yes. So since I'm much more of a yapper than Josh, I'm going to defer to him. No, I'm going to defer to Josh for the first question so I don't get carried away.
Yeah, so and it's interesting when we go out to school or do school visits or talk to any schools that a student might be involved with who are experiencing School Can't, the first thing that I so often find is, it's a school refusal. And I feel like my role as an OT is coming back to it's not they're not refusing to go to school and I'm thinking about the definition of the word refusing, but it's they actually can't get there. And emphasizing the point of can't. It's not a choice. There's something that's going on.
Yeah, well, that's
and
the
refusal
thing.
very much implies you are choosing to.
Yeah. So School Can't really encompasses that it really is a can't. It's not necessarily that they won't. They will if they can, potentially. That's okay. Just kicking the microphone.
Sorry if you heard that,
They're still getting used to all of these extra things.
I know, there's so much around me.
But I suppose when we're thinking about School Can't, what are the things that we really are trying to unpack for clinicians or as clinicians if we do have a client or a parent come in and say, look, we are having, I have a client at the moment that often every session mum just sort of reports with, we're still having school refusal in the mornings.
Yeah.
What are we trying to make sense of there?
Well, may I offer you a definition?
Yes,
to start
I would love
with?
that.
Yes, because I feel like in order to support people to understand how to work on it, you actually need to know what you're looking for.
Yep.
So in terms of a definition for School Can't, there actually isn't a totally solid agreed upon definition as such, but there are some really common elements between what the evidence speaks about.
Yeah.
So School Can't is commonly defined by the presence of the next few things that I'll mention.
Yep.
So it's reluctance or refusal to attend school, often leading to prolonged absences. So this isn't just your one day off because you don't like sports day.
Yes. Yeah.
Staying at home during school hours with parents' knowledge rather than concealing the problem from parents. And it's a very American word, but it's all through the literature, truancy.
Yeah. Yeah.
This isn't
I believe
wagging.
we use wagging here in Australia.
I'm very interested to know how old we might be because
Maybe
is
they
it still
I don't
wagging?
know.
Any new grads, let us know.
I think that one though, I'll pause you on that one. That one's a really interesting one to wrap your head around and to understand the difference between truancy and someone that can't go to school.
Yeah.
Yes.
And the parent involvement there and everything that we'll unpack later. But
Yes, absolutely. So we've got reluctance or refusal to attend. We've got staying home during school hours with your parents knowing.
Yeah.
There's an experience of emotional distress at the prospect of attending school. So this is where you might be seeing your tummy aches in the morning, those sorts of things. There's an absence of severe antisocial behaviour, and that's important too because when we're trying to define what we're seeing and why, because that then obviously directs our intervention approach, which Josh and I will run you through. And then the last criteria here is there's parental efforts to secure their child's attendance at school.
Yeah.
And it's probably not working. But that's a good one to keep in mind because let's say you have a kid that is not going to school, and the more that you find out, you're like, well, the parents actually don't mind if the child doesn't go and they don't try to get them there.
Yeah.
Again, your intervention will look different. So those points are really great. So there's 5 dot points there that we mentioned.
And we, I suppose, here at Kid Link, and if you've listened before, you'll know that we're a family-centred practice here. And so we are working really closely with the family. And what we have seen and what we know to be true is that school can't has such a massive effect on not only the individual that's experiencing it, but that flow-on effect of, you know, like you said, if there's emotional distress in the morning in terms of getting up and getting to school and what that means for the parent or caregiver trying to get somewhere on time because they have to go to a job or not getting to go to their job because they're home with their child. All of these things are things that we're like constantly trying to make sense of and figure out, well, where do we put our efforts right now?
It's so interesting, Katie. I had a meeting with a school, I think it was like last week, with the parents there as well. It was all on Zoom, but it was such a part of my role within that meeting of advocating to the school about the whole family dynamic and the family context and what these efforts that the family are going through and as the support team are trying to get this kid to school, but the impact that it is having on the family is so often people just see like the raw facts of what's happening. So-and-so is not coming to school. But helping people to zoom out on the whole entire context of the situation. It was something like I've had a few school can't kids, but it was the first time where I really had to push that advocacy side for the whole entire family and support crew. So interesting point.
Yes, and I think because to go back to your question in terms of, well, what do we do and what are we wanting clinicians to do? One, I should have started with this tagline, but one of the biggest, if you've stuck around until now, you're now getting the hook. But school can't is a symptom, not the cause. So again, it is a symptom, not the cause. So someone is not it's not that they're not attending because they have school can't. They're experiencing school can't because of who knows. That's our job.
That's what we've got to try
That's what we're looking to figure out and what we'll take you through a little bit. But that's probably one of the biggest things that we wish people knew.
Because we are to some degree like addressing the school can't, and we're working with the school and forming goals around that. But our role as clinicians is often working on the thing that has led us there.
Can't. Yes. It is to just be, have a goal around school can't and not addressing any of the factors that have led to it. It's just too reactive and it's too far downstream.
It's not going to work.
And that's the other thing. It's not going to be effective. I think I've got one more bit of info and then I'll kick over to Josh to have a look at, why do we see it then? If it's just a symptom, tell me what's underneath. Is that also there is a bit of a spectrum might be the best word for school can't. So, yes, you can either be experiencing school can't or not experiencing school can't, but it's important to sort of zoom out and to be like, okay, you can have some attendance problems, and that might be more a day here or there, or you've had a really crappy few days at school and you have a couple of days off. You might have some attendance issues. It's not school can't. You then may actually start seeing early signs of school can't. So think back to those criteria that we mentioned. You might be seeing some. Then you've got established school can't where all those criteria are met. You've got someone who has had a lot of difficulty attending for a long time. Some of our kids are, years. Ongoing. And then you have at the top what I would say is more like, unenrollment or disengagement completely. So someone who isn't even enrolled within a school.
And doesn't have that contact with school anymore.
No, they're actually not even like on the books for school anymore. So that's sort of, the spectrum. I would say.
I think we talked about it as a bit of a continuum as well.
Oh, that's the word. Thank you.
When
continuum.
we presented on it.
Yes. So I think that, if we can, as we move into this and what Josh will take us through in a sec, but is that we see it as a symptom, not the cause. We've got our criteria and there's a bit of a continuum as to what you're seeing. We certainly don't intend for it to be black and white, like either school can't or no. It's more of a continuum. And I think the continuum works well too because you can fluctuate. We absolutely can move from someone who is completely disengaged to maybe experiencing school can't, someone who's experiencing school can't, to having no attendance issues. But then the next year, moving back up again. So thinking of it of a continuum will really help to, I guess, set the scene for what we'll go through in terms of well, what do clinicians do
and
then?
consider what the support needs are and that kind of thing. Now, I know that you've said that, we really need to understand the underlying cause, I suppose. And I think for us, I'd love to know your thoughts. And I know that last episode we brought up Ross Green because we are massive fans of Ross Green. But something that Ross Green talks a lot about is collaborative solutions to problems. And that he refers to like a strategy that doesn't necessarily have that collaborative component, where just the adults in our life, in the kids' life, are trying to come up with answers. Often it's not going to lead us to solutions.
No, because it's unilateral.
Yeah. So when clinicians have a child or a parent or caregiver come into sessions and say, look, this is something we've noticed as an ongoing challenge within our family unit, how might we try and establish that root underlying cause?
It's such an interesting question because when we were developing these presentations and webinars and stuff, we were pulling our hair out as well. It's like, what is a framework or what is just a way that we can think about school can't and pulling out of these things, and how do we even start this process of collaborative problem solving? And what we came to was that kids are either stressed or bored or they're coping.
Yes.
And that being a contributing factor to why they can't go to school at that given time.
Yeah.
But understanding that there's skills and also demands that are present while at school and like
school
their
is
own skills.
Full of them.
Yeah. You think about the academic challenges, you think about the social, the emotional reg.
Well, that's the thing. I think that a lot of the time parents or caregivers that might not have an understanding of the whole like lot of ideas of demands that could be in the school environment. They just look at the academics and go, well, you love maths. Like you've got maths today. Why don't you want to go? But what we know is that demands are in all these different presentations in the school environment.
Big time. And then like when our skills outweigh what those demands are, just like anything and anyone, like if we're, I don't know what an example would be.
Let's go with cricket because you'll be able to.
I'm not bored with cricket.
I can't do golf. No, but I'm bored with. Oh, hang on. No.
When your skill outweighs demand.
Skills outweigh demands. No, sorry. I was going to say if you were playing cricket with me.
Yeah.
I would be very bored very quickly.
Yes.
Is the demand that playing cricket against Cowie presents is not anywhere near my level.
All right. I would like to rewind a little. We've never played cricket together. I could surprise him.
I'm also glad I haven't been dragged into that example.
He never lets us forget he got a sports scholarship at ACU. So he's good at cricket. Whatever.
But you're right. We do see like a lot of kids that we might have in our therapy rooms, they might have particularly strong smarts in maths or in science or something.
Absolutely. And then the work that they're being presented is boring for them.
Yeah.
So like any situation, whether it's a classroom or me playing cricket against Cowie, why would I want to do that?
Yes. Yeah.
Well, for the friendship, but anyway, move on.
But then you flip it and the other end of the scale is that we're stressed about something when the demand outweighs our skill.
Yes, yeah. Which I would say is like, not to say that the boredom presentation doesn't necessarily come up, but I would say we probably see more of the stress
Absolutely, because I think too, and I wonder if one of the reasons for that as well is that within that school can't criteria, you've got feeling distressed. And, I mean, it's in the name, but the stresses are often more stressful than the boredom.
Yes.
Because it can be sometimes, obviously depending the person, but sometimes a little easier to manage feeling under-challenged than over-challenged.
And it's a big feeling stressed. Like it is very, very uncomfortable.
Yeah.
Not to say that boredom isn't uncomfortable.
No, but it has a real physiological effect for
we
us
certainly
as well.
see far more stresses than boredoms, I would say. So, and what Josh has just given us, if you want to paint a little picture in your head, literally like some old school scales that tip from sort of one side to another. If you're balancing skills and demands, when the skills outweigh the demands, you've got boredom. And when the demands outweigh the skills, you've got stresses. And then you hit that nice middle point where you're roughly coping.
Yeah, and coping doesn't mean that there's never a demand that triggers a little bit of stress. Like we learn best when we're challenged.
Yes.
But this is when the child is perceiving that demand to be well beyond
Well, that's the
what they
thing,
have
isn't it? Like,
capacity
let's
for.
say Josh and I playing cricket. put to the side the fact I'd be so bored and focus on if we were if I had to play cricket with him and he was teaching me.
Yeah.
The demands outweigh my skills for sure. But you know what I do have good skills in? Coping with things that are hard.
Yep.
So actually when you zoom out and look at the whole picture, I'm going to find that really challenging, but I'm going to be okay.
Yeah.
And so I think that's what OTs are so good at, and what Josh alluded to before with how many factors there are to consider, is that's what OTs are. Oh, and you mentioned it too, actually. Sorry, Katie, that we consider so many factors of, rocking up to a maths class is actually like 100 little demands packaged into one.
Yeah.
And so just because similar, let's say I find the maths work hard, but I have the skills to ask for help.
Yeah,
I have the skills to cope with a little bit of distress. I socially am all right to not scream out maybe and wait until I can ask a mate for help. I have so many
with the annoying kids that might be sitting behind you as well, and all of those other social demands, not just directly placed on you too.
So when we talk about this coping, it doesn't have to just be your math skills matches the math demand. It's really all encompassing.
Yeah. So I know that we kind of workshopped a little bit of a sort of like a collaborative tool that we might then sit down and do with kids. But I suppose, what are we trying to figure out when we do these things? Because like I said, I think that a lot of the time schools have got that zoomed out lens, and they don't, school can't really relies on the child's perceived experience, not what they actually just can and can't do from an academic perspective or that kind of thing. So we're really trying to work with a child or adolescent to really understand what their experience is in terms of what is difficult for you at school and what makes you feel comfortable at school and that kind of thing. Have either of you done any of that in your sessions recently?
The better question is, when haven't I done it recently? I think in relation to school can't specifically. But No, for sure. I think that I'll start with a little quote that I'm just going to tweak. So Mona Delahook, great author, as well as clinician, highly recommend looking at her work. We can just chuck her name in the show notes or something, I'm sure. Similar to Ross Green vibes, but in terms of a quote, she has this beautiful one that safety is in the eye of the beholder.
Yeah.
And it makes me think about, pretty much anything, but that the challenges you experience are in the eye of the beholder.
Yeah.
It doesn't matter if I'm telling, or if Josh is telling me, no, you'll be fine. You know enough about sports to play cricket.
Yeah, you know how to join in a cricket game.
Yeah, I'm telling you.
I love that we're using cricket after every
the most boring
We will
thing.
never speak of cricket ever again after this, I'm sure. Once Josh
Maybe I
is
should have used golf.
podcast has turned into this boring cricket podcast.
Something about Josh cutting grass. I don't know. Anyway, it means that we really need to find that the difficulties are in the eye of the beholder. So just really drilling home, I guess, what you mentioned. Because, Josh, when have you sort of recently-ish?
Well, I want to understand what my client's experience is of whatever situation it is, and whether we present that through a self-rating scale or something similar, written or visual, whatever's going to fit your client and whatever they're going to feel most comfortable presenting their ideas and their experience with. And that can be on a scooter board if the kid's a little bit younger and whizzing up and down the room, an easy and a tricky end of the room. Present little visuals to the kid, and they can place it where they feel. At Kid Link, we had the parent in the room as well. So often I'm telling the parent, I really want to understand kids' experience right now. You'll obviously have your own take on this as well, but I want to understand what the kid's got to say.
Coded for please do not influence these results. My goodness.
And doubling down on the either visual or written, and that being a really important way for the kid to be able to communicate what their needs are and their own perception.
And usually doing something like that helps us to form collaborative goals as well, which, generally speaking, if you ask them straight up, their answer might be no when you say, do you want to get back to school kind of thing. But when we're looking at like, do you want that thing to be easier for you?
Yes.
And is that something I can help you with? Usually they'll be somewhat on board with setting that kind of goal.
Yeah, it's so much in the language, isn't it? And then
Yeah.
I did one of the scales that Josh is talking about just the other day with one of my clients who's probably moving into the established school can't.
Yeah.
And it was interesting. I found how much the wording really impacted because he rated things that were easy, and Mum and I sort of looked at each other and were like, what?
Yeah.
Like, okay. Interesting. We'll keep going. But he still rated some things as hard. So I was like, I think he understands.
Yeah.
Anyway, and then when I asked a bit of a follow-up question, I was like, oh, is that easy? Can you tell me then, you know, because we have a pretty good relationship. And I was like, I thought that was hard because, and we explored, and he goes, oh, no, it makes me furious, but it's easy.
Yeah.
So it's technically easy
yeah.
to ask for help. He interpreted it as, in fair play, as asking for help, saying, I need help.
Yep, those words.
Is technically easy. Asking for help within the school environment, I should have, and this is what I'm changing my rating to next time to get a bit more info from him, is how angry does it make me? Because that is the language that he is speaking in.
Yes, yeah. And so often it really does rely on us as therapists to break that down and not just put down those visual cards or written cards around, you know, recess as an example. And you might really think about what are all the possible demands. And that was something that we workshopped during our presentation, is getting clinicians to really think about what are all the possible demands that a child might experience in X, Y, and Z at school.
Your example there, Cowie, it made me, and it set off a bit of a light bulb for me. I've got a kid that I'm working with at the moment that's like well and truly in the established school can't realm. But we've been able to zoom right back out to look at a basic needs point of view. And so often I feel like, and I don't know what you guys have to say about it, but that basic needs bit is left off the cards, and we're not thinking about it, and such the importance that this plays in just anyone's well-being.
Yes, actually. And then we're swapping light bulbs, because then I have a client that I can probably give you a really good example of for that we actually moved more into the non-attendance phase. And the client came thinking, well, we're experiencing school can't, I need to get back to school. And after meeting them and chatting with them more and everything like this, I then, you know, have a look at basic needs, and I pull out Maslow's hierarchy, and we have a bit of a look at what we can find. And this young person is not sleeping for more than like 4 hours a night. They are barely eating. Their mental health is incredibly poor, and we don't actually have an accurate diagnostic picture. As if I'm going to come in and make a goal around reattending school. I share that hope. Obviously,
that's the long-term goal.
Absolutely. I really hope we can support this young person to engage within an educational setting. But we pulled right back, and the goal was around them meeting their basic needs. So, I hope they will be able to get to school. I hope they'll be able to do many things. But that's not there right now. You know, you think about, even if we just even take the sleep one, how rubbish you feel after one night.
Well, that's the thing.
Not sleeping very well.
4 hours every night.
You know, so I think that that's really important, and such a big part of our role as clinicians to help people to I hope someone can word this better for me, but like not set their hopes or goals on something realistic. We are being paid for our professional opinion, and that professional opinion is this. So, and I always talk about, I share that hope with you, and I do, but my clinical reasoning and recommendation to you is that we're here, and I will help you with the building blocks to move up. But that hope is up here.
Like, how important is that also to communicate to schools that we still might be in touch with and working with, and just like the entire care team, like, hey, we've found these. Our sleep needs are way not being
That's
met.
where the focus is.
And I actually, for this client as well, got in touch with the school because I was trying to set up a meeting and stuff, and then I found out all this info, you know, through asking about them. That's the other thing, knowing, I guess a big thing that Josh and I thought about as well, that for clinicians to know is that, it's school can't, but like we said, it's a symptom. So what's underneath? So go digging. Is found that out, and I got in touch with the school, and they're like, oh yeah, we could set up a meeting, but by the way, like, you know, she doesn't really attend, et cetera, et cetera. And then I got back in touch with them and was like, actually, you know, parents and I have spoken more about it, and we're going to focus on meeting basic needs because of this, this, and this. And they were like, you know what? That sounds perfect.
Yeah.
We'll be in touch if anything changes.
Yeah.
But what was I meant to be doing when I found out that she goes about once a term?
Yeah.
The school, like, we're just not at that
and when
point
the goal
yet.
is just to get her back as well.
Yeah.
And I think that's an interesting point, because we do often get that, whether it be from the school or the parent and caregiver, in terms of like, our goal is just to get them back to school. Whereas we might also look to, and it's obviously going to be an individualized choice, and we're going to consider all the factors, but maybe returning to that specific learning setting isn't also the goal we're looking for.
Actually, that is a great point, and something that we researched and spoke to in our presentations was that often, and understandably, it's where most people go. What comes to mind is your mainstream school settings. Your 5 days a week on-site learnings, actually, is what I should say. It doesn't have to be mainstream. But there are alternative methods.
Yes.
And that can be really suitable for some of our kids.
Yeah.
Absolutely. Like whether it's virtual schools or and there's stacks of like re-engagement programs as well. So having a look at like broadening what our considerations are to re-engage with some aspect of education.
And also re-engagement doesn't necessarily mean going back 5 days a week.
No.
Like, it might quite literally just be trying to aim to hold that sense of school community for that child. So we're just going for recess to play a footy game with our friend, and then that's our attendance for the day. Like, it is too much for us to kind of set our sights on just getting them back full time from the beginning. So I think something else that probably comes up a lot for us as clinicians, I know that, yes, we've spoken to, particularly for OTs, our role being, we need to kind of explore and dig for that underlying cause, and often that's where we'll be targeting our intervention. We often find ourselves landing in IEP meetings or any kind of school-related meeting to do with a child's school can't. So what would we say to clinicians that are like, well, what is my role in this meeting here?
Good question.
I've stumped them.
I know. No, your podcast hasn't dropped out. Josh and I are looking at each other. And to be fair, I really thought I've got a few things. But
first word that pops to my mind is, though, advocacy.
Yeah, great.
I've mentioned it a couple of times in the points that we've spoken about, like whether it's advocacy for the family, advocacy for the child, everyone involved. That's the first word.
Yeah,
to my mind.
And you know what? Because I'm just trying to pull apart how the meetings usually go, I guess. And so big things would be the understanding of school can't, which totally links in with what Josh was saying. Really trying to, shift that perspective of it's not this kid is refusing. So that's a huge one. The other thing that I think we really bring indirectly. So, for example, not within that meeting as such, but I have beforehand, obviously time permitting, have upskilled the family on what they are entitled to and what we are looking for. That we are, I feel like as OTs,
and where they might be able to get more like targeted advocacy support as well.
Like ACD,
kind of
the Association for Children with Disabilities, offer some brilliant advocacy
Is that Victorian-based, that one?
I believe so. But there's
I think
also,
each state in Australia generally has something along those
and there's
lines.
school, I'm pretty sure it's called School Refusal Australia. I would double check and I can chuck the note, the link to you for the show notes. But helping the family to understand what we're there for and what we're leaving for. I'm sure everyone has an experience in any form of meeting, any form, where you leave and you're just like, what did we get out of that half an hour?
I think a lot of times schools might invite therapists for solutions.
Yeah, and everyone in these meetings too, and we get it, they are pressed for time. And so I really love going in with a clear plan of this is what we are trying, well, not trying, this is what we want to achieve, is what we want to leave with. What are our follow-up points and who is responsible? So I feel that we can bring, and they already have structure, but I mean structure in terms of understanding school can't. So like if you do know that what we're looking for is that, okay, OT role, we're going to support this young person to be sleeping more than 5 hours per night. That's actually my first thing. Who is taking care of supporting their transition in the morning, because they're going to be starting at 10 whilst we're learning to push back this bedtime or whatever it is, right? But understanding how you can start with basic needs and then move forward actually really helps, I find, with the division of responsibility.
Yeah, and holding that person or people accountable.
Yeah.
Well.
So that's the stuff too where we give parents, some documentation ideas and things like that just to help with the process. I mean, as OTs, we're so function focused that I'm like, how is this meeting functional?
Yeah.
So, and then I see the role too as to be giving strategies, obviously, but really in terms of division of responsibility of, hey guys, we've done the digging and we found all of these things out. How are we going to divide and conquer? And I also love leaving knowing with what's doable.
Yeah.
There is a difference between being right and being effective. I say that to myself quite often.
I only really learned of that in the last few weeks, but it's like for one of my clients, it is like literally at the front of my head. Like that is what we're kind of working
do I
on.
want to be right or do I want to be effective?
Yeah.
So yes, I am correct in saying XYZ would work. But the school might not be at that point for, say, stages of change or literally like their time and resources allocated. We know how hard that is across a lot of settings. So for whatever reason, I might be technically correct about what my recommendation would be, but that doesn't always mean it's effective. It's really about leaning on a lot of those clinical reasoning skills, as always, to be like, how can I actually help this kid? Quite a broad answer, really, when I think about your original question.
I think, well, this is the thing, because we're not all, those that are listening might not also be OTs. So to have a broad answer is probably helpful as well.
Yeah.
But I think it's probably a nice spot to kind of land on, in that probably our final step of that picture would be, like holding those accountable and regularly coming back to that and regularly checking in on that progress and that kind of thing. Because if we leave that meeting and don't check in, that's where people drop the ball a little bit. Yeah,
absolutely. And I think that's the thing too, that it's nice that you can have like the continuum of the maybe some difficulties with school attendance all the way up to complete disengagement, because
checking in.
You can check in with where things are going. And again, if school refusal is the symptom, not the cause, when you see those symptoms popping back up, that's your thing to go, I wonder what our causes are. And go again.
Yeah. I think I'm going to finish on that. I know I can't keep coming back to Ross Green, but we do really love his like kids do well when they can do well, essentially. So we're really trying to build up those kids in terms of their perspective of themselves being able to do well, but really making sure those supports are in place around them as well.
Definitely.
Well, thank you for joining.
Cool. Thank you for having us.
You're so welcome. I'm sure we'll see you both again soon.
Yeah, I might be better at cricket when you see me next.
Go out and practice. Don't get too bored there, Josh.
No.
All right, we'll see you next time.
Thanks, Katie. Bye.